Good evening, everyone, and welcome. I am Jatin Mahajan, Managing Director of JMitra Co Pvt Ltd. We are India's leading in vitro diagnostic company, and I am your host for this live edition of the Voice of Healthcare Futuristic Friday. Today's topic of discussion is value of digital innovation in the India medtech sector. The medtech environment in India is booming. Innovation is fluid and driving the growth curve at a rate of around 15% per annum, as per various industry estimates. So, how is the Indian medtech segment poised with respect to the global scenario, and what are the factors that can contribute to the phenomenal growth and catapult India on the same platform as US and Japan? Friends, in the spotlight we have Ms. Urvashi Prasad. She is Senior Public Policy Specialist at the government think tank's NITIAayog. She is also part of the government empowered group for managing the COVID-19 pandemic in our country. Let us learn from her insights and knowledge as she shares her inputs on the various queries. Good evening, Urvashi ji. It's nice to have you here and share your views and inputs on this exciting subject.
Good evening. Thank you for having me.
Yeah. So, Urvashi ji, my first question is, can you please share the exact status of the Indian medtech industry, especially with respect to the global market?
Yes. So, I think the Indian medtech industry sector, it's very much a sunrise sector, as you mentioned, one which has huge growth potential, but in many ways is at fairly sort of early stages of exploiting that growth. If we look at the major segments, for instance, within the medical devices, the medical technology space, most of our companies or a large number of our companies are domestic companies, still operate at the lower technology end. So, they are producing devices like, or equipment like consumables and disposables. Whereas there is so much more in this space. Of course, you have the diagnostic imaging, you have your dental products, you have orthopedics, prosthetics, we have implants, artificial joints, we have patient aids, there's pacemakers, but there's so much more, in terms of the medical technologies. Now, our smartphones, there is so much that can be linked to our smartphones in terms of tracking health status of patients, also tracking their treatment for chronic conditions. So it really is a whole range, and a lot of our companies, and we do have a large number of micro, small, and medium enterprises. Of course, we have a lot of startups in this space, which is very encouraging, and a lot of them have done incredible innovation, including during the last year, during the COVID pandemic. But a lot of them are still not operating at the kind of scale and with the kind of turnover, and also at the high technology end, which would really allow us to capture a larger part of this global market. So, of course, as you said, it is growing fast, but there is a long way for us to go, because there is a huge potential in this space. Even if we look at Asia, we have very large markets like Japan, China, South Korea. Even among the top 20 globally, we have a lot more competition, and there is scope for us to really make our presence felt in these areas. So yes, it is growing fast. There is huge potential. But what we need to do is address some of the long-standing challenges in terms of the manufacturing cost disability that we face here. So we don't really see a cost advantage when it comes to manufacturing. We've had various other regulatory and policy issues, which of course I'll come to, and which the government has attempted to address over the years and is still working on those. The whole research and development, ecosystem, and where we can really not just innovate, because India is an innovative country, but actually take those innovations, through to market and eventually become globally competitive. So a lot of these areas we've historically faced challenges, which has sort of held us back. But the potential in this segment is huge, especially in this post-COVID era, where a lot of other trends are now becoming relevant, and I can speak to some of those. But this is, overall in terms of where we are, it's still a very import heavy sector. It's, we're still a net importer. India is still a net importer when it comes to this whole segment. And there's no reason for that. We can really drive up our exports in a very big way if we have the right sort of enabling environment. And of course, now that we are seeing a lot of innovation coming in from the private sector, from the startups, as I mentioned. Now, of course, the inflows into this sector have gone up. It's important to look at that when we just look at the sector overview. The government has allowed 100% foreign direct investment in this space under the automatic route, both for brownfield as well as greenfield projects. So we've seen a lot of FDI inflows coming in. But as I said, there is a long way to go. It's a sunrise sector, and there's a lot more to be done to really tap its full potential and really bring India amongst one of those leading markets, not just in Asia, but also across the globe.
Right. Okay, I'd like to build up on the point you had mentioned that we are operating in the lower spectrum of the medtech. On the higher end, we are only providing back-end support to the international MNC companies. Why? And why are we not present in the higher end of the spectrum? How can we change these dynamics? Can you share your views on this?
Yes, so as I said, that I think we've been this whole segment has faced a lot of challenges historically. So we've had issues related to the cost of manufacturing, as I said, vis-a-vis competing economies, and a lot of that is due to lack of adequate infrastructure, inadequate supply chain, logistics, high cost of finance in many cases, and then also shortage of quality power. Design capabilities is another area. When we're talking of these high tech segments, and looking at our design capabilities, our focus on research and development has really not been adequate, or it has not been at the level that it should be. So as I said, all these factors coming together have somewhere not really allowed us to be competitive in this sort of global scenario from multiple dimensions, that I just mentioned and outlined. But there's no reason why that cannot happen if we have the right kind of enabling environment, the right kind of policy environment, and that's certainly the direction the government is trying to take. But as I said, there's a lot more to be done, because we're starting from a very low base when we look at this sector. For the longest time, medtech was actually not even considered distinct from the overall pharmaceutical sector. They were sort of lumped together. So it's been a long journey for us. Now, of course, as I said, it's very encouraging because we have a lot of startups coming in with some very cutting edge innovation and using the most cutting edge technologies. So I think that is changing. But for us to really establish ourselves in that space, we need to be addressing all these issues that I said of, the cost of manufacturing, access to finances, the research and development, the, logistics, supply chain, all of these factors. And then, as I said, some policy regulatory issues. We've had inverted, duty structures, which have been issues. There have been so many other challenges that we've had, delays in regulations, etc. So I think all of that has held us back collectively somewhere. But now there is hope for the future. I believe with the government also taking a serious recognition of this sector in its own right, and also all the innovations coming forth from the private sector, especially from our startups, from our smaller companies. As I said, we have a lot of small companies. We have about 750, 800, almost in India, manufacturers, but a lot of them, the turnovers are relatively limited. The scale is small. So, sort of the economies of scale that we talk about, we do have some distance before we really reach there.
Right, right. And since you talked about the policies, can I understand what is the policy and environmental changes that we may look forward to from the government to support a higher growth trajectory of the industry?
Right. So, as I said, that for the longest time, we were not even considering, medical devices, medical technologies as distinct from the pharma space. So, we were starting with that base. Now we've taken steps forward. So in 2017, Government of India notified the medical devices rules, which actually was sort of the first major recognition that, this is a separate sector. You need to regulate it differently. You need to look at quality standards here very differently. You need to bring in aspects like certification, third-party evaluations. You need to streamline the whole approval process, because our approval processes can also be notoriously difficult. And there's so many different ministries and departments, etc., involved. So that was the very first recognition. I feel major recognition in recent times in the policy space. Then, of course, we've also had the National Essential Diagnostics List being finalized. We now have a medical devices safety, effectiveness, and innovation bill, which has been drafted. And if that gets passed, of course, it's going through all the discussions, and we've also received a lot of comments. That's actually a bill that NITIAayog has been very much involved with as well, along with the ministry. And that bill really aims to improve ease of doing business very significantly in this space, providing a strong environment for innovation, for manufacturing of medical devices in India, to really give a boost to the domestic manufacturers and make sure they have a level playing field with the global players. So that is, I think, one entire piece of work that's going on the legislation, the regulation. The other is on the actual manufacturing ecosystem cluster development approach. And the government is really trying to promote these medical device parks. Of course, a lot of you might have heard of the Andhra Pradesh medtech zone, which is a comprehensive healthcare ecosystem, which is really going to, it has a plug and play model where, it has all the facilities available. It has all the essential infrastructure available that companies require, and they would have easy access to those. These are common facilities, and they can pay for them on a per unit basis. But there's also an encouragement and a boost to, the whole research and innovation component. So there is very much a plan to set up more of these parks. Of course, strengthen the existing ones, but also set up more of these, because we don't have enough yet. So in fact, in 2019, Andhra Pradesh, Telangana, Tamil Nadu, Kerala, all of these states were accorded in principle approval for establishing new medical device parks. And in the Atmanirbhar Bharat package, also there are performance-linked schemes which have been announced for boosting both domestic manufacturing of medical devices, as well as setting up these parks in a big way across the country. So I think these are some of the steps that the government is taking, and a lot of these have been taken in the last few years. In the competitive public procurement order as well, the government is now giving preference to local suppliers of medical equipment, of medical devices during the tender selection process. So I think there's a lot of different steps that are being taken, but I think the most important is that the sector is now sort of getting its recognition in the policy space, because once that happens, a lot of other issues, addressing them is a natural process. Some of it does take time. Even before the budget, we had consultations with a lot of providers, players in this space. And of course, there were many areas where they feel that, so much more can be done. And I think I completely agree with that. But just, viewing it from the policy perspective, from the government perspective, the way I see the fact that so many of these initiatives have been taken just in the last few years, we are now sort of picking up the right kind of momentum. And hopefully, as we go forward, we should see a lot more happening, in this space to address the other sort of roadblocks and hurdles which are coming in the way, and really set India on that path of achieving a very, prime position in the global markets as far as this sector is concerned.
Right. Speaking of challenges and roadblocks, I would like to draw your attention towards the duty structure also. If nominal duty protection is good for Make in India, as an enabler for industries like auto components and mobiles. What's holding the government back in replicating the same thing as far as the medical device segment is concerned? Because as you rightly mentioned, 70% of the medical devices are actually imported. So can we have your views on this, please?
Yeah, definitely. And this is something that we have, time and again, not just in the context of the budget, but even generally, as NITIAayog, we have often, recommended this that these inverted duty structures need to be addressed. And I think there is a recognition of this, no doubt. As I said, some of these changes, sometimes it can seem a little frustrating on the outside that they don't really happen quite as quickly or at the pace as we would desire. So I think I get that, but we're completely in agreement that this has to happen. These have to be corrected, and I think there have been occasions when steps have been taken, but it's a huge gamut of policy issues that we need to address. And as I said, starting from a very low base. We are really trying to work our way up and build our way up. So this is something that I think hopefully, fairly soon we should see a lot of these sort of issues and distortions also getting corrected. Yes, it is something that could have happened much earlier, and that is what we also, because I said we interface a lot with the industry, and we continuously try to channel that feedback as well to those who are making these decisions. So I think we're completely in agreement that a lot of these things need to be corrected. But as I said, it will happen, and it should happen quite soon. And especially as part of the Atmanirbhar Bharat, I think it's been very good that the sector has got separate recognition, distinct from the pharmaceutical space. And so I think a lot of these issues will also, over a period of time, and hopefully soon, they should get addressed. So I think that is what I would say. But as far as we are concerned, we certainly do channel this feedback. We certainly push for these sort of issues to be corrected, rectified, and really try and boost the sector in as many ways as we can. So yes, certain things happen quicker than others. Other things can take time. There can be some issues, but I'm sure that they will get addressed fairly soon.
Right. Okay. You also spoke about R&D. The current environment is not very supportive of R&D and innovation. This curtails the possibility of growth. Do programs like Atal Innovation Mission and Arise have any bearing on the medtech industry? Your overall views on how the government plans to foster the R&D and innovation for this sector?
Right. So yes, again, a huge space. We have really been pushing for, of course, the expenditure firstly, on R&D overall to go up. Now, of course, this is not just a government responsibility. We also need to see the private investment in R&D go up, and I think that is something we also keep trying to find ways and means for how do we catalyze that private investment as well, because to begin with, R&D spend in India is very low, and out of that, currently the government is fairly major part of that R&D spend, but as I said, it's very low to begin with. So I think both the government as well as the private sector, this is one area where in general there needs to be a big boost on spending, because it all starts from there. But then, as you said, some of these programs, and Atal Innovation Mission, of course, NITIAayog is one of our major programs, and there what we are trying to do is to bring in this whole culture of innovation, and definitely medical devices, or generally the healthcare space is a major focus in that. And now after the pandemic has certainly given a fillip to interest in these areas. I mean, even previously we've had grand challenges and things like that, which have been related to the healthcare space broadly. But now that the pandemic has happened, we are seeing a lot more interest, because with the Atal Innovation Mission, we start right from schools. We start very, very early. We have our Atal Tinkering Labs in schools, and then we sort of build our way up through the entire ecosystem, because we want to create this culture and this spirit of research and innovation. So that is something that through the Atal Innovation Mission we're really trying to tackle that part. Then we're also working on frontier technologies, and actually there's going to be a lot of intersection of the work we are doing in frontier technologies with whatever we are doing to promote innovation in healthcare, medtech, etc. In terms of how do we use artificial intelligence, how do we use machine learning, Internet of Things, all of this has so much potential, and again, there's no reason why India cannot really capitalize on this, because we are also a very data rich country. In fact, we are sitting on so much data, and in the healthcare space, we have so much data, but we haven't really been able to capture it systematically and derive the kind of value from it that we should be. So we are also trying to look at that intersection of how do we use these frontier technologies to further drive, research, innovation, development of, innovative technologies. And definitely the whole medtech space is going to feature very prominently there. And as I said, more so, after this whole pandemic.
Right. You spoke about the new age technologies. In fact, when you spoke about data in fact is the new oil. Analysis of data is very important. So we have concepts like the Internet of Things, machine learning, artificial intelligence, and robotics. These are terms which are being now regularly being used in the medtech space. Can you explain these terms and its impact on healthcare in India? How is the government viewing the various developments? Can you share your views on this?
Right. Yeah. So, I'll keep it relatively, simple so that it's understandable for everybody on these technologies, and it's sort of more linked to their application and how they are practically fitting into our programs. But basically, a lot of these technologies, the idea is they really enable us to capture the data at the kind of scale, that we need to in India, and then to be able to make sense of that data, to be able to identify trends, to be able to predict. A lot of this data has a predictive value. So when we are talking of artificial intelligence, we are saying that India is so short of doctors, we are so short of specialists, we can't have doctors, specialists everywhere, and we actually reach a point where a large part of the diagnosis can actually be done by using artificial intelligence, because it can sort of sift through all the previous data. It can sift through
Right.
all the previous trends, the past trends, and make predictions for the future, or predict which treatment is likely to be most effective for a particular patient, etc. So it's basically deriving value from this huge data set. Now, the problem in India, as many of you would know, our data has been fragmented. It's not been integrated. A lot of it is actually not digital. And that's why the government has also launched the Digital Health Mission, because we first and foremost need to digitize this data, have it in a form which is, easily shareable. Of course, we need to build in the safeguards, and that's where blockchain comes in, because, blockchain can allow us to, share these records and this data in a safe and secure manner. So first, is that priority of the government, and then is, okay, we have all this data. What do we do with it? What do we understand from it? What predictive value can it have? What are the things it can make easier for us? Which don't have to be done manually now, or you don't need a person sitting there to try and sift through all this data and make sense of it. So that's really broadly speaking how we're trying to use these technologies in this space. As I said, as a government, we need to first build in the enablers, and the very first is first having a digital ecosystem, which others can then make use of, and then seeing how do we really apply these technologies in a very practical sense, because most of India, we're a very diverse country. There's huge inequities, so we need to see, yes, we have all these big technologies, but how do we make them very practical and relevant to our context? And I think that's a big area that the government is working on. But of course, as I said, we are working with a lot of startups, collaborating with them in a very big way, because that's where the cutting edge of the innovation and the new developments is happening, and the government is trying to really bring in that whole sort of enabling ecosystem and trying to put in those necessary building blocks, which can then make the use of these technologies in this space much more effective.
Right. Talking about the ecosystem, you talked about digital ecosystem. A lot of changes have happened in the past couple of months in terms of the remote diagnosis. delivery of healthcare segments, and the payment ecosystems connected with the healthcare services. Can you explain this?
Yes, so the pandemic has, as I said, it's brought about many different changes. And I think one, we started off with, we had to have physical distancing norms. People could not come to health facilities. So we started off with telemedicine, and we saw a big adoption, increase in the adoption of telemedicine, not just in metros, interestingly, beyond metropolitan areas as well, because, that's where we want to push it. Because most of India is, it's not just limited to our metros, it's the tier 2, tier 3. Eventually, we want these technologies to reach rural areas as well. So I think that was one very encouraging sort of trend that took place in this last year, where people became more accepting. Telemedicine is not a new concept. But it's been very difficult to scale it up in India because, people were somewhere they still wanted that physical consultation. They still wanted to go to the facility in person, meet the health provider in person. So I think the acceptance of a lot of these digital technologies, it opens up a lot of opportunities for home healthcare as well. And I think this is very interesting for the medtech sector too, because now, more and more you might have, people who are wanting to avail health services within their homes. You might have things like, regular tracking of chronic conditions, monitoring of chronic conditions, because while we talk of India being a young nation, we also have an aging population. So the incidence of chronic diseases is also going up. So you need regular monitoring of these, regular, treatment. And I think medical technologies can play a very big part in that. And, what kind of role do we play is, I think, a big question for the sector post the pandemic. But also in facilities, we had things like remote monitoring of patients in hospital wards. We had tele ICUs. So we had so many new things opening up, which we actually, as a country, we hadn't really explored very much in the past. So I think it opens up a huge new gamut of, as I mentioned the segments in the beginning, but those are your traditional segments that have existed for the longest time. But I think this new digital era, or this post-pandemic era, has now sort of really opened it up into so many more opportunities. So, the whole digital space, I think, is really very exciting for this sector, because there are so many more technologies that I think people will also become more accepting of. And of course, as the affordability levels go up, as urbanization goes up, the middle class is growing in India. So I think all of those factors will come together eventually to make it quite a favorable time to, be in this sector.
Right. You spoke about pandemic. The corona pandemic has shaken up the existing framework. All the business models have changed, and they brought about major changes and transformations. Can we have your views on this and how it has created newer possibilities in the medtech space?
Right. So I think one big shift that has happened is the recognition of prevention, and going towards wellness. Because we've always been a very cure-focused health system. When we've talked about health, we've only thought of hospitals. But now, for the first time, I see that even within the government, we are talking more of wellness, well-being. And that really opens up, I think, a whole set of opportunities, because now, if I'm going to be more conscious of my health, if I'm going to be more in charge of my health, then I need the necessary technologies, tools to enable me to do that. So I think that is one very major trend that we are seeing, people wanting to say that we want to be healthy and well, and that doesn't just mean absence of disease, but that actually means, entire overall well-being, which is physical, mental, that entire sort of definition of well-being. So I think that's one very major shift that we will hopefully see and will hopefully continue, beyond the pandemic. But of course, immediate opportunities, as I said, use of digital technologies to provide remote services in people's homes. In health facilities, we will still need to maintain very strict infection control, distancing. So what will that mean for the whole health facility? Will we have to almost rethink the hospital? As we've known the hospital in the past, it might not be that way in the future. So I think it's really changing at every level. But for me, the most encouraging is the shift in mindset that what used to be that health is, it's only when you fall sick you go to a hospital and that's the end of it. Now people are realizing that that's not the end of it. In fact, you have to think of health and well-being throughout. Otherwise, you can land up in a crisis situation like this, which ultimately doesn't impact just health; it impacts your entire economy, your entire society. So I hope that this recognition is really what will sort of continue in the future, and will open up then many more different opportunities which have so far been relatively unexplored, given the kind of health system we've been.
Right, right. So before I conclude now, because I would request you if you would like to say something or add something more that probably our viewers would like to hear or we have missed out.
I think we've covered really all the key aspects. But as I said, I think it's a very exciting time to be in this space. For anyone watching, who's interested in being in this space and is thinking it's very difficult, it has challenges. I completely agree that it's been difficult, up till now. But I think going forward, this will definitely be an area of focus for the government. Hopefully, as I said, we'll have more private investment coming in here as well, because it really has to be a public-private partnership that will sort of propel it to the heights that we would like to see. And also, I think the shifts, as I said, the behavioral shifts, the other sort of demographic trends that are happening are all very favorable for innovation in this sector. So hopefully, we'll see a lot of exciting work from startups, from new entrepreneurs coming in, new technologies, because the unmet need in India is simply huge. And there's so much that this sector can do. We talk of numbers, we talk of global positions, but we can really change lives. And I think that's the message I would leave with, that the sector has the potential to truly change lives and make a difference to quality of life.
Right, right. So, Urvashi, thank you very much. Uh, those were extremely valuable inputs. I found this discussion extremely interesting and insightful. Personally, I would have loved to continue this discussion, but we have to keep this short for the viewers. We certainly would like to connect again and benefit from your knowledge and understanding of this subject. As you rightly said, India has made a lot of strides in the medtech segment in the last couple of years, and I can see the growth trajectory. Well, there are some hurdles and challenges too, and government is committed to creating a very conducive ecosystem for the development of the medtech segment and allowing it to compete in the global arena. We look forward to a great time ahead for the Indian medtech industry. Thank you. Thank you, all of you, for taking time out for this episode. We hope to have you back again for another exciting webinar. Till then, goodbye and take care. Thank you all. Thank you.